So good afternoon. Thank you, Gustavo, for the invitation and the introduction. I work for Sanofi. I've been working on Project DataSphere for 2 years now, so it is my pleasure to introduce Project DataSphere initiatives. So first, I will walk you through the journey Project DataSphere has been on for the past 4.5 years, and then I'll talk a little bit about making the Prostate Cancer Dream Challenge from an organizer's perspective and share with you what we learned through the process. First, a little bit of background for Project DataSphere. CEO Roundtable on Cancer is founded in 2001 at the request of President George Bush Sr. It is a nonprofit organization that made up of chief executives of more than 30 American companies. And membership include life sciences companies, advocacy, several of NCI-designated cancer centers, as well as company that's outside of the healthcare arena. But they have a common goal of helping to fight cancer. Life Sciences Consortia is a task force of the CEO Roundtables on Cancer, and focusing on solving issue that cannot be solved, that's related to cancer medicine that cannot be solved by any company alone. And Project DataSphere is an independent initiative of the Life Sciences Consortia. So I want to take you through the journey that we have, and the concept of Project DataSphere was initiated in 2011. The team spent the next 2 years focusing on overcome the barriers for data sharing. As you can see, the biggest barrier in data sharing, especially for cancer clinical trial data set, are privacy and the legal front. So we were able to build a legal framework that allowed broad data sharing of cancer clinical trial data set. And the next year, we spent on building resources, analytical as well as technical resources, to make Project DataSphere possible. SAS is actually a big sponsor, and they support the technical platform for Project DataSphere, and they also provided free analytical tools on the website for researchers to use. Project DataSphere was launched April 8th, 2014, and we worked for the first year busy on onboarding data set onto the Project DataSphere platform to build enough in the repository. By the end of April of 2015, is our 1-year mark, we're able to reach 25,000 patient lives on the platform. And now we have 12 data providers from government, industry, and academia. And we're continuing to work through that in 2015 into 2016. This is the landing page of Project DataSphere. Actually, a month ago, we had a facelift in November. We have a new web design for the platform. Project DataSphere is a place to share, integrate, and analyze cancer trial data set. We have phase 3 clinical trial from industry and academia, comparator arm data. I want to talk a little bit about comparator arm. When we initiated the idea of clinical trial data sharing, there were discussions about treatment plus control arm versus control arm, and we resorted at phase 1 of Project DataSphere for being control arm only, because there's much less legal hurdles sharing control arm, much less concerns from life sciences company as well. I'm happy to say that we're actually working actively right now on phase 2 of Project DataSphere, sharing both treatment and control arm on the platform. So what do we have? We have raw, anonymized or de-identified patient-level data and documentations, including redacted protocol, clinical report form, as well as data dictionary. We also have state-of-art analytical tools freely provided by SAS. There are 3 tools. There is a visual analytics tool, a programming tool, as well as a data management tool on the platform. We also have a community. It's a Facebook-like tool to enhance collaboration and communication. So if you want to start a project, you could actually start a private group to invite members and use the platform to communicate with your team members. And feel free to go to the website and check out what's on the platform and check out the data on the platform as well. I want to talk a little bit about the progress we're able to make in the first year. We started Project DataSphere April of 2014 with about 4,000 patient lives. and a little bit less than 200 users. And many of them are friends of Project Datasphere that provided feedback when we built our platform. We continue to grow, and you can see we launched the Prostate Cancer Dream Challenge March of this year. We can see a huge uptake on the users front. It definitely bring all the participants of the challenge as users of Project Datasphere. At the same time, there's an uptake on the patient lives as well. It's just a coincidence because we're trying to hit our 25,000 patient life goal. And there's a lot of the data coming in the last 2 months. And both continue to grow after that. This is some key metrics of Project Datasphere. Out of all of our users, we have majority of them coming from academia, about 60%. And the rest of them come from life sciences industry as well as clinical practice. We have international crowds. There's users from 44 countries. On the platform, right now we have close to 30,000 patient lives and 12 tumor types. Majority of the patient lives is on prostate, breast, colorectal, and lung. And we have 12 data providers up to now. And some of them provided many data sets. Sanofi, for example, provided 16 data sets, more than 10,000 patient lives. AstraZeneca is up there as well. We continue to work with existing data providers as well as new ones to onboard data onto the platform. So some take-home message for Project Datasphere. What makes Project Datasphere different from other data sharing initiatives? I think the main goal of Project Datasphere is to advance cancer research. So it is broad access. So what does broad access mean? Meaning the data is available to a broad audience. As long as you're not debarred in the United States, you can register, become user of Project Datasphere, and start downloading data. There's no research proposal required for access. There's no IRBs. To me, for researchers, that's freedom. You don't have to have your analysis plan ready before you start exploring the data and test your ideas and experiment. We also have resources on the platform. Not only we have the SaaS tools and the computing power, but also you can stay connected with the community, share ideas and insights through the community tool. Project Datasphere initiative itself is a proof of principle. We have commitment from the industry and academia. We have interest from the researchers. We have over 10,000 users now. There's more than 3,500 downloads from the website. And user-initiated research is emerging from the platform. We see poster sessions in major scientific arenas in oncology as well as in peer-reviewed journal. We also have impact for use case development from the website, and we have a upcoming publication in collaboration with NCI. We also have the Prostate Cancer Dream Challenge, which is a perfect segue going to my I guess second part of my presentation about the making of Prostate Cancer Dream Challenge. Some of you already know Prostate Cancer Dream Challenge is a collaboration between DreamSage and Project Datasphere. We have data from Project Datasphere provided by AstraZeneca, Celgene, Memorial Sloan Kettering Cancer Center, and Sanofi. We also have support from the Prostate Cancer Foundation as well as NCI and researchers that help to organize, other researchers from University of Colorado or Texas and can help organizing this challenge. This is the first crowdsourced research challenge in prostate cancer. And we have a scientific steering committee, all of whom are prostate cancer experts that help us to draft the research question. The challenge run this year for about 4.5 months from March to July. I want to talk a little bit about the data, which is part of the making of the challenge. And we have 4 prostate cancer trial data sets from Project Datasphere. 3 were combined for training. 1 is held back for leaderboard and validation. It is a homogeneous patient population. All of those patients are first-line metastatic castration-resistant prostate cancer patient undergo docetaxel treatment. And we use the raw trial data from the platform to generate challenge data. The curation took about 4 to 5 months. It's actually a strenuous process. We have to evaluate each trial supporting document as well as the data to to have a better idea, because every trial comes from a different sponsor. And we were able to identify about 12 to 15 key tables from the original raw trial data set. So every trial will have about 30 to 40 data. And we're actually taking only the 12 and 15 key tables and standardize them and consolidate across all 4 trials. We also draft a list of covariants that are important for modeling related to the challenge question as well, to make sure that they get created. Besides the core table for modeling, we also provided 5 standardized raw tables for the participants to explore and create variable if they need it. There are a lot of nuances for clinical trial data sets. So for this challenge, the core table only have baseline information and static. I just want to mention that out of the longitudinal table, the training data set is, to me, quite valuable, because they have baseline plus beyond for patients, and can really actually be used for many other researchers beyond this challenge. And we have a lot of documentation and wiki in the data dictionary to help folks pay attention on how to use the data that's provided for this challenge. I want to show you a little bit on the planning and execution for this challenge. And I actually asked Gustavo and Thea during the challenge, how long does it take to prepare for a challenge? And I was told on average about 4 to 5 months, and it took us 13 months to prepare for this challenge. So what did we do? We actually spent a good amount of time working with the scientific steering committee on establishing the research questions and really going through the data, help us on scoping. And the data curation took the longest time. So we have about 7 months lag because of what it takes to prepare these data sets. And we launched in March and have over 550 registrants. I will leave the detail of the challenge for Jim to talk about after. I want to share with you my learning as an organizer to this challenge. I cannot speak for Jim, who are probably much more experienced than I am. This is my first experience. So I believe incorporating feedback from previous challenges are very valuable. There's an ALS challenge before us that's also using clinical trial data set. We try to get the perspective from data provider, organizer, as well as from participants, to explore what is the optimal format for the data for better performance during challenge. And that really helped us in the scoping period to have a better understanding what type of data we want output. And I think documentation is critical to handhold, especially those who are new to clinical trial data sets. And personally, I believe balancing the essential elements for the challenge participants use, as well as leave room for innovation, is important. We provided extensive lists of covariants for the model. However, we also avoided being exhaustive to allow some room for creativity coming from the participants themselves. There is an educational agenda behind this challenge. Clinical trial data set before Project DataSphere has not been, to my knowledge, has not been shared broadly in the broad community, because there's a lot of legal and privacy concerns. So most people who would not have much experience working with clinical trial data set unless you work in a clinical research environment. So having Project DataSphere with this data sharing initiative and working with Dream and Sage for this challenge allows cross-disciplinary exposure to clinical trial data sets, and more people get to learn about how to work with the clinical trial data set. From our end, we're hoping to get a fresh perspective from the user as well. So to end, last but not least, I learned as an organizer to be open-minded and trust my collaborators and have fun through the process. Thank you for your attention.
We have time for 1 or 2 questions if there is any.
Yeah, well, thanks very much. That was I didn't know about this research, and I'm very happy to see this type of development, because
Great.
I'm an academic myself, so this is the type of data you like playing with. So my question is there a way that you can link the clinical data to in the cases where it was accompanied by omics data, like well, variant calling, things like this in the cases for cancer. So is there also some genomics data available behind these clinical trial data, at least in some cases?
Currently, Project DataSphere only have clinical trial data set. That's raw clinical trial, and I think the current strategy is to stay in that arena. So I don't think right now the data set on Project DataSphere can be linked to genomics. I think there are other resources that has genomics data that shared, you know, including Sage and have, but we currently don't have both. But not saying that in the future we couldn't actually work on a challenge that have data provider that provide both, but might not be able to share in such broad ways, because genomic data sharing, there's a lot of privacy concerns on that.
Of course. And then can you maybe give an overview of the type of clinical data that's generally available? Is it survival times, things like that?
So the clinical trial data we have available, most of them, we call them SDTM, which is raw, whatever you capture from clinical report form. So that's as raw as possible. It has everything from anything you capture in the protocol. If a clinical trial, usually people have to write up a protocol, and then there are report form that gets submitted into the study. So whatever is being captured through the clinical report form will be in the data. But one thing I have to say, after de-identification, because de-identification was a responsibility of data provider. Some data provider might feel certain information they don't feel comfortable sharing due to privacy concerns, so some of them might not be available. In general, what I have seen is pretty complete of what they capture from the field for this trial, for the trials they run.
Okay, thank you.
Thank you.
Okay, thank you.